So axilla. Axilla is a pyramidal space situated between upper part of the arm and the chest wall. It resembles a four-sided pyramid and has the following. It has an apex, base and four walls. Apex, base and four walls. And what it is? A pyramidal space situated between upper part of the arm and the chest wall. The axilla is disposed obliquely in such a way that the apex is directed upwards and medially towards the root of the neck, and base is directed downwards. So axilla is described under following headings. The headings are boundaries, content, axillary artery relations, and axillary lymph nodes. So first, the boundaries. The apex or the cervico-axillary canal is directed upwards and medially towards the root of the neck. So the boundaries are, as I said before, apex, base and four walls. So apex is directed upwards and medially towards the root of the neck. It is truncated, pointed and corresponds to a triangular interval bounded by anteriorly by posterior surface of clavicle, posteriorly by the superior border of the scapula, and medially it is bounded by outer border of first rib. This oblique passage is called cervico-axillary canal. The axillary artery, axillary vein and brachial plexus enter the axilla through this canal. So this is the model of axilla, and it is situated this way in the body. This is the apex, base and the four walls. Now the apex, anteriorly it is bounded by posterior surface of clavicle. The clavicle is situated here, and posteriorly by the superior border of scapula. So clavicle comes here, scapula comes here. So anteriorly by posterior border of clavicle and posteriorly by the superior surface of scapula, and medially it is bounded by outer border of first rib. And this passage is important. This is cervico-axillary canal, and this gives passage to the axillary artery, axillary vein and brachial plexus. Then this is the base or floor. This is formed by skin, superficial fascia and axillary fascia. This is convex upwards. Now this is the anterior wall. It is formed by three structures, which is pectoralis major, clavipectoral fascia and pectoralis minor. Formed by what? Pectoralis major, pectoralis minor and clavipectoral fascia. Then comes the posterior wall. This is also formed by three structures, which are subscapularis above, then teres major and latissimus dorsi. Subscapularis above, teres major and latissimus dorsi. Then comes this medial wall this way. This is formed by third or fourth intercostal spaces, then serratus anterior muscle and long thoracic nerve and intercostobrachial nerve. Third or fourth intercostal spaces, serratus anterior and long thoracic nerve and intercostobrachial nerve. Now the lateral wall. Lateral wall is formed by upper shaft of humerus, coracobrachialis and short head of biceps. Formed by what? Formed by upper shaft of humerus, coracobrachialis, and so the muscles related with humerus, coracobrachialis and short head of biceps. So the diagram for axilla will be, this is the rough diagram which we have to draw for the boundaries of axilla: anterior, posterior, lateral and medial. Now the contents of axilla are axillary artery, as explained earlier, axillary artery and its branches, axillary vein, then infraclavicular part of brachial plexus, then the 5 groups of axillary lymph nodes, long thoracic and intercostobrachial nerves, axillary fat and areolar tissue, so these are the contents of axillary artery, vein, brachial plexus, lymph nodes, long thoracic nerve and intercostobrachial nerve, and axillary artery. These are the basic arteries, veins, again veins, lymph nodes, nerves and fat and tissue. Now axillary artery and its relations in the axilla. So axillary artery is the continuation of subclavian artery. It extends from the outer border of first rib to the lower border of teres major muscle, where it continues as the brachial artery. And the pectoralis minor muscle crosses the artery and divides into 3 parts: the superior, posterior and inferior part. So this is the axillary artery. This is the axillary artery. This is first rib. Then this is subclavian artery. Then here we have teres major muscle, and here is the brachial artery, and here comes the teres minor muscle, which divides this artery into three parts: the superior part, then this is the posterior, and this is the inferior. Superior, posterior, and inferior part. There is a correction. The axillary artery is divided into three parts, not by teres minor but pectoralis minor. So the relations of first, second, and third part of axillary artery. This is the first part of axillary artery. Relations are classified as anterior, anterior, posterior, median, and lateral. Anteriorly lie the pectoral fascia, pectoralis major muscle, clavipectoral fascia, and the loop of communication between lateral and medial pectoral nerves. The posterior relations are medial cord, long thoracic nerve, and serratus anterior muscle. Lateral relations are lateral cord, posterior cord. Medial relations are axillary vein. So as we saw in the relations of axilla also, anteriorly we had the pectoralis major muscle and pectoralis minor and clavipectoral fascia. Similarly, we have it here, and also in the second part of axilla, we'll see it later. And medial relation, axillary vein. Posterior relations will be the serratus anterior first and second relations. Okay, and then laterally we will have lateral cord. Now the relations of second part of axillary artery. Anterior relations are the same: pectoralis major muscle, then clavipectoral fascia, and pectoralis minor muscle is the new addition over here. As we saw, pectoralis minor muscle was dividing the axillary artery into three parts, and pectoralis minor muscle was coming superiorly. This is the posterior part of axillary artery. So pectoralis minor muscle will be present superiorly to axillary artery. And the lateral relations will be again lateral cord, and coracobrachialis will come here. We saw coracobrachialis also in the lateral relations of axilla. So here we have coracobrachialis, and posterior relations we have subscapularis, which was also there in posterior relation of axilla. Subscapularis. So axillary vein again, this is axillary artery again. Medial relations we have medial cord, axillary vein again. Now the relations of third part of axillary artery. We will have again pectoralis major muscle. Now pectoralis minor won't come here, and laterally we will have short head of biceps brachii, coracobrachialis. So if you have the idea of this axilla, you can write the relations of axillary artery also. Then musculocutaneous nerve, lateral root of median nerve, and axillary artery again, axillary vein. Medially we have medial cutaneous nerve of forearm and arm, and posteriorly we will have again subscapularis and the axillary nerve. So if you learn only the upper part of axillary artery relation, that is enough. Now axillary lymph nodes. These are 20 to 30 number, and they are divided into 5 set of groups. So those 5 sets are anterior, posterior, lateral, central, and apical. Now we will see this through a diagram. So this is the diagrammatic representation of axillary lymph nodes. This is anterior, posterior, lateral, central, and the apical group of lymph nodes. The anterior, posterior, and the lateral group of lymph nodes drain their lymph into the central group of lymph nodes, which further drains it into apical group of lymph nodes. Apical group also receives drainage from the infraclavicular lymph nodes, and then apical group transfers it into the subclavian lymph trunk. Now the clinical part of axilla. So the axillary group of lymph nodes not only drain the axilla, but they also drain the breast and the anterior and posterior body walls above the level of umbilicus. Then second is the examination of lymph nodes. So right axillary nodes have to be examined by left hand and the left by the right hand. Then the third one is axillary abscess to drain the axilla. So the axillary abscess should be incised through the floor of axilla and midway between the two axillary folds and nearer to the medial wall in order to avoid injury to the main vessels running along the anterior, posterior, and lateral walls.